Now, we've been talking today about new polling, which has revealed that 2 in 5 UK adults admit that they wouldn't know how to perform CPR in an emergency, and just 35% say that they would step in. Restart a Heart Day today. People up and down the country are being urged to improve their awareness of what to do in an emergency. Now, there's an event happening at Asda in Weymouth where you can pick up some of the skills you might need. And we can talk to one of the people involved in that now, Matt Denton, who joins me on the line, Managing Director of Medisave. Morning, Matt.
Good morning.
Good to have you there. Do any of those statistics surprise you? 35% of people saying that they would step in a medical emergency?
Not really, to be honest. I mean, I think a lot of people are worried what effect they will have if they do something like this. But echo what was said earlier on. Anything is better than nothing. We're down at, I've got to say Sainsbury's today, not Asda, but we're down at Sainsbury's today. We're trying to promote out of hospital CPR where the local defibs are. So we're handing out a leaflet that states, you scan a QR code and it tells you where the local defibs are. I think one of the most shocking statistics of it, sorry to use the expression, but is that female CPR, there's a 27% less likely intervention in female CPR out of hospital because of gender, because bystander CPR, people are worried how it will come across.
Okay.
So we're trying to raise awareness on this as well at the moment.
Yeah. I think there's been an awareness drive in recent years. That TV advert with your footballer, his name escapes me, Vince something, isn't it? And the staying alive music in your head, and also a lot more of these defibs around these days. And as we were saying in the last half an hour, my understanding is if you get those and you can get the code to open the boxes that they're in from calling 999, they will tell you how they work and what to do and where to put them and which buttons to press and all that kind of stuff in the most simple way possible.
Yeah, I mean, you simply turn the defib on, it will guide you through what you need to do. There's no, there's no kind of error with it at all. You turn it on and it will tell you to, take the patient's or remove the patient's clothing, put the pads on in a certain way. It will analyse the trace output from the heart and it will tell you whether or not a shock is advised. So there's no kind of decision making having to be done by the bystander. It does it all for you. They're so simple.
Vinnie Jones was the name of the footballer whose name escaped me.
That's correct, yeah.
And actually, I think I was getting confused because you got Vince Howe with you as well, Mark. If you pass the phone
correct.
over, Vince works for Medisave in the warehouse, but has first-hand experience of a cardiac emergency. Vince, take me back. We're going back 3 years ago. What exactly happened to you?
Well, I was in London and I was getting off a train at Clapham Junction, and I didn't know anything what was going to happen. So I take about 5 or 6 paces off the train and just collapsed on the floor.
Wow.
And don't get me wrong, there's loads of people around there at that time. And lucky enough, I had somebody that come along, knew exactly what to do, ripped my clothes, pumped my heart, because I had passed away for 4 or 5 seconds, I was told. And the defibrillator was right by him. He got the defibrillator and actually saved my life. And I was dead for about 5-6 seconds.
Crikey!
And I didn't have a clue what was going to happen or anything. And with the defibrillator right nearby, it saved my life. And I was rushed off to Tooting, St George's at Tooting, and stayed for 10 days in there. And then I was out and alive again.
Well, that's great as well, because the perception sometimes in London is, somebody getting off a train might just step over a person who was having a medical emergency.
There was a lot of people there, but lucky enough he did know what to do, so it was fantastic that I had somebody there that done it for me.
Oh my word. And I must ask, 3 years on from that, how is your health these days?
Oh, fantastic. I feel so much better. I eat better now. I walk a lot, and I just feel so much better now than what I did before.
Good. Go on.
Yeah, so we'll carry on, yeah.
I was going to ask you, that having happened to you nowadays, are you somebody who is a really strong advocate? I mean, if if you walked past you now and collapsed, would you be the person who jumped in, rolled up their sleeves and started doing chest compressions?
I think I would now, yes. After what happened to me, I think a lot of people should be learning more how to do it. And as Matt said, it's all on instructions on the defibrillator. So you can follow the instructions and do what it actually says.
Mm-hmm. I have you down at Asda tomorrow as part of this Restart Our Heart stuff. Are you at Sainsbury's as well today, are you?
We're at Sainsbury's today. I can pass you over to Matt to tell you.
Go on then, bit
exactly
more phone
are.
juggling. Why not? Thank you, Vince. Good to talk to you. That's Vince Howe there, who had a medical emergency himself back in 2022, and his life was effectively saved by somebody jumping in and doing the heart compressions and the defib stuff. We're back with Matt now, Matt Denton. Go on then, Matt. So, like I said to Vince, I had you down at Asda in Weymouth tomorrow. What are you up to today?
So we are in Sainsbury's today. What we're doing is we're handing out leaflets that have a QR code that just basically tells people where their local defibs are. So if they happen to witness something that needs a defib, they can just scan the QR code and it tells them where it is. It's so simple. What we're also doing is we've got 15,000 leaflets to actually send out with our orders over the next few weeks. Again, just to promote where the defibs are locally to people. Just literally put in which town you're in, and it will tell you where they are. And I think it's something called the circuit. So the circuit is where defibs are all on what it is a maintained database, and it tells you that defib is ready to be used. And if you call 999, it will give you the code to get into the box to unlock it.